I will start with first question. If you could please introduce us your project.
Hello, my name is Hrjove Brkic, as you have already mentioned, and the acronym of my project is SONORA, which stands for towards Safe, Optimized, and Personalized Radiology and Radiotherapy Procedures for Pregnant Patients. Although we have a long subject that describes basically activities that we are conducting within this project, we have several important goals that we want to achieve within this project. First of them is to conduct the screening of the current procedures that our medical physicists doing when they are dealing with the with the pregnant patients. After that, we want to develop physical representations of pregnant female phantoms because currently there are no available pregnant female phantoms. After that, we will create phantoms in 3 gestational periods, each gestational period one phantom. But we also want to create a library or family of pregnant female phantoms in order to, let's say, somehow personalize the procedures that medical physicists are doing. How we are going to do this? We will create a family of phantoms with different heights, body mass indexes, different gestational periods, different fetal orientations, because all of these modifications play a significant role in estimating fetal loads. In this way, medical physicists will be able to choose the appropriate phantom when their patient shows up in the clinics.
Thank you.
After, this is not all. We also want to conduct the experiments in radiotherapy and in radiology, and to actually estimate the doses to the fetus. And one also important part of our project is that we included the social science and humanities, which will create workshops with interested audience and which will create communication material for the patients.
Can you describe your consortium and explain how you selected and engaged your partners?
Okay, our consortium is very specific. Basically, we all met through Eurodas network. Eurodas is, as you probably know, a European radiation dosimetry group. And within this group, there are 2 working groups which deal with dosimetry in radiology and in radiotherapy. And when the Pianoforte opened its first call, we sat down together and discussed which topic will be interesting for application. Eventually, pregnancy topic won. And from this reason, we have so big, unusually big consortium. We have 17 members from 13 different European countries, but we are already doing all our activities within the Eurodas activities. So there is no problem in communication, in doing jobs, and anything else.
What key results do you expect from the project, and how do you foresee these outcomes impacting the EU community?
Okay, it's hard to me say which contribution is going to be the most important one, but I must name something. Eventually, the top of our project will be creating the dosimetry good practice guide, let's say, that will be offered to all European countries, all the European medical physics societies, how to deal with the pregnant patients when they come to the clinic. But this is only the top of the hill, because to be able to create these guidelines, we need to conduct lots of activities, measurement campaigns, creating the phantoms, and so on. Second, activity that is going to be very important is that, as I already mentioned, we have the social science and humanities part, where we will going to create communication materials for the patients and recommendations how to communicate with the pregnant patient. I think these two things are the most important one, and that will significantly affect the European community.
Thank you. The last question, which is actually following this one, is that your project has been running for about a year now. And what would you highlight as the most significant achievements so far?
Okay, it's been more than a year. It's like 16 months, and we have already conducted series of experiments. First of all, I will go through the work packages. In the first work package, we conducted the service to screen the current status of how the medical physicists are doing with the pregnant patients, how they are dealing with them. And this is nearly finished. We have already submitted the deliverables. In the second work package, we already created all 3 trimesters of physical representation of the pregnant female phantom in all 3 trimesters. And after that, the logical sequel of these anthropomorphic phantoms, we are currently conducting experiments. For example, first gestation period phantom is now in Greece and going to be shipped to Italy because they are doing experiments with them. Last week we had experiment with the second trimester phantom in Skandion in Sweden, and next week we will going to have the experiments with the third trimester phantom. Also, we are going to develop the tool for estimating dose to the fetus during the proton therapy. And this tool is, let's say, being developed, and it's in advanced phase of its development. And so far in the social sciences and humanities, we had within the last Eurodos meeting, we had the workshop that was held with interested audience about how to deal with pregnant patients. It was very interesting. 2 more workshops are going to be organized.
Wow, thank you very much. This was very enlightening, really.